Welcome to Older and Loving It, a program designed to address the legal and life planning concerns of seniors and their families. My name is Kathleen Summers. I'm an elder law and estate planning attorney with Summers and Associates, located in Acton, Massachusetts. Given the choice, most of us would prefer to have the option to stay in our own homes. Sometimes, however, people need help to remain at home. Today we are going to discuss what non-medical services are available to seniors and the various types of needs that these programs can address. Non-medical home care focuses on helping seniors with the daily activities they need to engage in to remain safe and healthy. Many seniors need help to get their day started with assistance showering, preparing breakfast, and taking their medications. Likewise, help before bedtime or even overnight can be an important safety net for seniors at home who often are more apprehensive at nighttime. We are fortunate to have Ryan McNiff, owner of Minute Women, Inc., which was established in 1969 and provides non-medical home care services. Minute Women is located in Lexington, Massachusetts. They offer respite, home helper, companionship, and supervision care, as well as other services for seniors in Boston and the suburbs of Greater Boston West. Welcome, Ryan. Thank you for joining us.
Thank you very much.
Let's start by just talking about what are non-medical home care services?
Absolutely. Non-medical home care services are pretty much what they sound like, non-medical home care. We provide anything from companionship and home helpers and personal services, making sure that someone can stay independent in their home. The difference between non-medical and medical home care is exactly what it sounds. We don't do anything with IVs, injections, or giving people their medications per se. That's where nurses can come into the home and help out with things like that.
And how do people usually pay for non-medical home care services?
Well, there's certainly various ways that you can pay for non-medical home care services. You can pay out of pocket for it. Long-term care insurance also can pay for that as well, and insurances can pay for that too.
Excellent. And again, what kind of services are really associated with staying at home? What are the things that you can provide to seniors and to caregivers?
Absolutely. Well, most people start out with transportation needs. We can help somebody out with their transportation by picking them up at their home, helping them get ready for whatever event they're going to, whether it's a social event or going to see a doctor over at Leahy Clinic. We help them get ready, escort them to the car, and then drive them there and can escort them up to the doctor, wait for them, and then bring them back home. Some of the other options that people use us for is home helpers. That's a really big option where people might need help making sure they're having nutritious meals during the day. They're making sure that they're getting up and getting dressed. The chores are getting done, linens are getting cleaned, laundry is being done, and basic bills and chores going out to get grocery. And various other things are getting done during the day. So those are the two big things where people start using us for, but that can also help out with companionship. Maybe somebody's lost a spouse and they just want to see somebody and have some interactions during the day or a few days a week. We can come in and help with that as well. So there are various different options, and the final one that people use us for is personal services, which is using the bathroom, shower, and getting somebody ready and dressed and ready for bed.
Are there minimum amounts of time that someone has to utilize the services, either daily or weekly?
Absolutely. Unfortunately, there are. We wish that we could come in for half an hour a day, but it's just not cost effective for the caregivers to do that. Generally, you'll find that most home care providers are between 2 and 4 hours of minimum service for somebody to come out and give them help.
And do you usually have the same set of home care providers who come in to deal with a client, or does that get mixed around?
It's really generally is the same person. It depends on the amount of care that somebody's needing. If somebody's needing, 7 days of care a week, you would have a caregiver that comes in during the weekdays and then a caregiver that comes in on the weekends. So at most you generally have 2 people a week, but if you're needing 24-hour around-the-clock care, it could be up to 4 people, where 2 shifts of 12 during the week and then 2 shifts of 12 hours during the weekend.
So you can do 24/7 as well.
Absolutely.
And then just to be able to help someone, as you said, with things like maybe personal care, bathing, getting dressed, and transportation, getting to doctor's offices.
Absolutely.
And will caregivers, you said that they will also do things like shopping, personal shopping for someone, and taking them to get groceries and other?
Absolutely. Basically, our tagline is we empower seniors to stay in their homes. So we've found over the years of our 44 years in business is that most people want to stay in their home when they're aging. They want that independence. They want to be in a place where they're comfortable with, where they've been there for a long time and they don't want to have to move. So we'll do anything within our power to keep somebody to stay in their home if that's what their wishes are. So if that means coming by, 2 or 3 hours a day for one day a week, we can do that, or we can go up to 24 hours a day of care. Generally, when people are needing 24 hours of care, maybe families away in another state or they can't be there at all times and somebody's frail, they're worried that they might fall getting in and out of the shower or fall going to the bathroom or fall while making food and cooking in the kitchen. So we're there as a safeguard to make sure nothing bad happens to that person while they're in their home.
Now, if an elder has family who provides care for them, how can non-medical support be helpful to them?
Absolutely. Generally, that's kind of the normal scope of it, is that somebody's usually helping out a senior. It can be family, it can be friends, and a mixture of both. But as time goes on, it becomes more and more difficult between what we call sandwich generation, which is somebody that's in their 40s and 50s that's raising their own children, and now they're trying to take care of their parents or their in-laws. They're dealing with work and just everyday events as well. And eventually something has to change with that type of schedule. It has nothing to do with the amount of love that somebody's getting, but it has to do with there's not enough hours in the day to be able to do all the things they need to do, and that's where we can come in. It has nothing to do with somebody not caring about their loved one. It has to do with having extra assistance so they don't get burned out and that they can have quality time with the person that they love. There's nothing fun about having to go over and take care and do all the chores and make sure everything's done during the day for someone. Well, if we can come in with non-medical home care and make sure all of those chores and all those personal care and transportation's taken care of, their family members can come over and have quality time with the senior, the grandparent, or their parent.
That's one of the key places that we see it with clients is around the personal care area. It can be very hard sometimes for a child or a loved one to step into that aspect of it, and to be able to turn to a home care company to provide those services can really be helpful.
Absolutely. That's one of the more awkward situations. I went through it when my mother had cancer. I'd moved down to Florida to be by her side. And one of the awkward things is when you're used to seeing your mother or your father as a strong, independent person, and now they need help with some of these intimate and awkward situations. That's where someone who's a professional that's seen it all can come in, and it's more about business than it is about someone that's a family member seeing you in an awkward and a vulnerable situation.
How do you go about connecting up caregivers with a family?
Absolutely. There's a process involved in that. I can only speak about our process and not necessarily everybody's process, but what happens is somebody gives us a call or reaches out to us where they need some type of non-medical home care. What we do is we try to qualify their needs over the phone the best we can, so we have an understanding if we can help that person. That's the first and most important thing. If that phone call goes well and everybody's happy with what's said, is that our elder care manager would come out at a place of their convenience and meet with them, meet with the person getting the care and the family members if they like, and have a face-to-face conversation about what the needs are, what's going to happen, and answer any questions that inevitably come up in these situations. The next step would be, if everything goes well there, is to start contacting a caregiver or caregivers that we think would be a right fit personality-wise and what their expertise is in that home. And once that's done, the caregiver would come out or over the phone have an interview, and then the final step, if the interview goes well, is to place them in the home and start giving the care that they need. And of course, we would be making sure that everybody in the situation is happy, the caregiver, the person receiving care, and the family members as well.
And if I were going to be starting to look to find a company to provide these kinds of services, what are the things I should be looking for in terms of the company?
Absolutely. There's plenty of companies out there to choose from, and a lot of them are reputable. The first thing that I would recommend is making sure the person has a lot of experience. We have 44 years of experience, but you don't necessarily need that much. But you want to make sure that as the baby boomers are getting older and older, you're not using somebody that just started up a year ago or 2 years ago. You want somebody that's been doing this for quite a long time. With that being said, you want to make sure that the caregivers are background checked, that the caregivers have been Corey background checked and that they've had an extensive interview and background process to make sure that they're upstanding people that are trusting and respectful of not only the home but the person that they're giving care for.
And what is a Corey check?
Corey check is basically a background check for Massachusetts to make sure that they don't have any checkered history, if you will.
Okay, so making sure no criminal history, that
Correct.
kind of thing, in terms of people coming into your home.
Absolutely.
I'm sure that's one of the biggest concerns that people
Absolutely.
have is.
Yeah, that, and then we want to make sure that when we have a caregiver coming into a home, that they're just a good person in general. So we require 6 written references from any caregiver. We also call and verify those references as well and talk to those references and ask them some questions to really understand who this person is. And that way, and because of that, we've had very low incidences of issues. If there's ever a problem with a caregiver, it's more of a personality conflict than anything, and that's something that's inevitable at any point in time over the course of a home care lifespan.
And how do caregivers get paid? Are they employees of your organization?
Mm-hmm.
Are employees of the senior? How does that work usually?
Absolutely. Most home care companies, the caregivers are employees of the home care company. We're a little bit different. We are not the employees of the caregivers. The family is. When we started in 1969, that was kind of the common practice. Whether it was a butler, whether it was a nanny, whether it was a caregiver came into the home, they were they were an employee of the family they were using. We understand that that is not necessarily the status quo now, and some people aren't comfortable with that. So we have ways that we can make sure that their taxes are taken out, insurances are taken out, and they're not a employee of the family. Okay. So there are 2 options there. The reason we have the 2 options is that sometimes people only need respite care. They only need a weekend. You know, we have Thanksgiving and Christmas coming up and different holidays.
What is respite care?
Sure, respite care is when somebody just needs a short amount of time. Sometimes it's a few days, sometimes it's the week of just of getting care, whether they're a family member's going on vacation or they have a lot of chores that they have to do at home with their own children and their own family, and they just need a few days where somebody can come in and take care of them. Mm-hmm. So with that respite care, the IRS has a limit of $1,500. If you pay someone, they do not have to claim that with the IRS. So if somebody is only going to be there for a day or 2, you can just pay them cash, and then that's the end of it. You don't have to worry about taxes and things like that. That's why we allow the 2 options, so that people have flexibility in what they want to do.
But would you still recommend, in terms of, you know, sometimes seniors go out and try to hire people on their own. Mm-hmm. I guess in terms of the benefits of that as opposed to an agency, or the benefits of using an agency to be able to place a caregiver. Can you talk a little bit about that?
Yeah, absolutely. There are 2 ways of thinking on that. If you're going on to somewhere like Craigslist or using a neighbor or somebody that you don't know to come in and provide care, you might hit a home run. They might be a great person and it might go exceedingly well. But the problem is that usually Corey background checks and references aren't checked, and you're not 100% sure who this person is until they've had, you know, maybe months of experience in your own home, and then you know that they're a good person and they're capable of doing that job. The benefit of that is usually you're paying less money because you're directly paying someone cash or a check to do these services. While if you go with a home care agency, you're going to probably be paying a little bit more, but you also have that peace of mind of knowing that this person has been background checked, they have the experience and the skills to do the job that we're putting them into the home to do.
Mm-hmm, absolutely. When people are thinking about different levels of care, and home care versus something like assisted living and then nursing home care, can you speak to a little bit about the differences in that and how home care can support that, or the cost associated with home care compared to these other options?
Absolutely. There's my feeling on assisted living and home care and nursing home is that we're more of a team than we are competitors trying to get people's business. Usually people, when they need some care, only need a certain amount of hours per week. They don't need 24-hour care, and that way they can keep the costs low. If you're going into an assisted living or into a nursing home, you're going to be getting 12 or 24 hours of constant care, and that's what you're paying for. If somebody needs that, by all means, you know, I'd say go to an assisted living or a nursing home. But if you know that somebody only needs a few hours a week, then you're really overpaying for services that you're not utilizing. So with us, our charges are $19.50 an hour, which is inexpensive compared to some of our competitors in the area. Some of them can get up to $26 and $28 an hour. With assisted living, the range is different with how much it costs, but it can be tens of thousands of dollars a year, and nursing homes can be close to $100,000 a year. So if you're getting 24-hour care, it might be comparable price-wise with a home care versus an assisted living, but if you're only getting 5 or 6 hours or 10 hours a week of care, it's going to be much lower cost than the two alternatives.
Now, can you only provide home care services within someone's private home? Do you also sometimes support if someone is in an assisted living, or is there any restrictions around what you're able to do?
Yeah, absolutely. I mentioned in the last question how we kind of work as a team, and so when a home care company becomes unable to maybe give as much care as that they're looking for, maybe they need some medical care, or we're getting close to where 24 hours of care and it's just too burdensome, you might want to move them on to an assisted living or a nursing home. There's kind of a corresponding way that it can go about it. With the assisted living, we can go in and help with assisted living. Assisted living is of assistance, so it's not 24 hours care per se. So if somebody needs an extra few hours a day that the assisted living can't provide, then we can come in there, we can go in there and give them that assistance. We can also go into, there are things called skilled nursing facilities and short-term rehab facilities where we might be able to, depending on how each skilled nursing facility works, some of them don't need assistance from a home care company, but sometimes they do allow home care companies to come in and assist with some of their patients as well, and we can do that too. So it can be in-home or it could be in a facility as well.
We have the holidays coming up now, which is an opportunity for families to get together and check in on loved ones who they may not have seen for a period of time. Are there signs that people should look for, or maybe that would kind of cue them in that assistance might be helpful here? Is there anything in particular someone could look for when they're talking and dealing with their loved ones?
Absolutely. I mean, there are physical signs, and then there are more mental signs. If somebody looks very frail and they're struggling getting up and in and out of chairs or couches or upstairs and downstairs, and you're worried about them falling or problems like that, that's an obvious sign and a red flag. If they look malnutritious, if it looks like they haven't been eating well, that's another sign where a home helper can come in and provide them a nutritious meal. So those are kind of some physical signs. If they don't look like they've been showering often enough, if they look like they haven't been bathing often enough, that's another sign. With the mental side, when you're dealing with things like dementia and forgetfulness and Alzheimer's, those are diseases that slowly creep up on somebody, and it's not just apparent one day. It's a string of memory lapses that occur over a course of time. And if you keep noticing that they're forgetting names that they've known for years, or they're forgetting schedules that they've been doing for years and things like that, it might be a red flag to say maybe we should have somebody coming in there and helping with assistance. Usually the first step in home care is transportation. Somebody's not able to drive themselves anymore, and the family feels like they might be a danger on the road, and then that's where we come in with the transportation, and it can go from there where the transportation turns into a home helper, which turns into supervision and things like that.
Now, with transportation, is that a service that has to have a block of time that's associated with it? How does that work in terms?
Absolutely. So with the transportation, usually there's not a minimum from us, but usually it's at least 2 or 3 hours of transportation involved. Not because it's not a taxi. It's not picking someone off, picking somebody up and then dropping them off. It's escorting them to the car. It's bringing them to where they need to go, which is usually 30 minutes away or so, and then bringing them up to the doctor's office, or bringing them to the social event that they're going to, and escorting them while they're there, and then doing the process all over again. So usually it does take a couple hours, so there's no real minimum that's always met. Generally, if somebody needs a ride 5 minutes away, they have a family member or a neighbor that can provide that 5-minute ride for them generally. So that's what we find, that it usually takes a couple hours because we're escorting them as well.
So the transportation isn't limited to just things like medical appointments.
No.
It can be for social events too.
Absolutely.
Grocery shopping at the mall, those kinds of things.
Absolutely. We have a gentleman that likes to do his own grocery shopping. He just doesn't have the ability to drive anymore, so we we pick him up and we drive him to the grocery store and we spend the time with him while he's picking out his items, and then we drive him back.
It's great. It also gives your caregivers a chance to check in on someone and see how they're doing, kind of just a well-being check with someone when they're
Absolutely.
providing these types of services.
Absolutely, because communication is key in any business, especially in a business where you're helping others in home care. So we want to make sure that a family member and the one we're caring for is always open communication with our elder care manager and the caregivers themselves. So they have to be able to connect and communicate to make sure that all parties are doing well, everything is getting done when they're meant to be getting done.
And as communication, it's definitely key. Is that something that you set up in terms of communicating with family if appropriate, and being able to share information when appropriate about the senior?
Absolutely. We have every way of communication as possible. Basically what we can do is we can have a caregiver have the cell phone of the family members so that the family members can call the caregiver directly, the family members can call me directly, and the family members can call our elder care manager directly. So we have open lines of communication, and certainly we want to give updates to the family as well when something happens, good or bad, with a family member. We'll let them know.
What's an elder care manager? You mentioned that that's a position you have.
Absolutely.
What is their job?
Basically, our Marianne is our elder care manager. She's been with us for 25 years. She's a great lady, and her job is really to schedule and make sure that the right caregivers are going to the right families. When somebody calls in, usually the first words out of her mouth are, "I have a great caregiver for you. I know exactly who we should place with you." She knows all the caregivers because many of them have been with us for 10 and 25 years, so she knows them like the back of her hand. So her job is to make sure that the right caregiver is getting into the right home, and as well as following up and making sure that caregiver is doing an outstanding job and everybody's happy with the situation at hand.
I'm sure personalities can have a lot to do with it in terms of
Absolutely.
picking the right caregiver for a family.
Absolutely.
Right. One of the things that we often hear is people mixing up like visiting nursing services with home care services. Can you explain a little bit about what those differences are and how you might work with a visiting nursing service?
Absolutely. A visiting nursing service would fall more under a medical home care company or the VNA hospital or something like that. So if somebody truly needs medical care and medical assistance, they would be calling a VNA, while if they wanted to non-medical care, they would be calling somebody like us for companionship or supervision or some of the other services that we've provided.
Are they usually exclusive of each other, or can you sometimes have both VNA services as well as home care services provided?
They certainly can work together, but usually they're exclusive only because the visiting nurse can check in on people and do some of the things that we do as well as provide medical care for somebody.
So you guys really come in after that medical care is finished in order to continue to just provide the additional support and services someone needs.
Absolutely. We can work with as many people as needed, but we can work exclusively as well.
That's fantastic. And we've focused a lot here on seniors, of course, in terms of home care, but do you also deal with younger populations who may have disabilities and need additional services at home?
Absolutely. We can help out anybody of any age. Generally, it's seniors that are calling us, but people, maybe they've broken a leg or broken a foot and they're in a wheelchair now. They need help with some of the cooking and some of the chores and laundry and things like that, and we can come in and have assistance for them as well.
And so they can have this full scope of services as well involved in the home care provision in terms of the companionship and transportation if they need it, the personal care, all of that.
Absolutely. We actually just had somebody call us up 2 days ago, and that was the example I gave. She had broken her leg, and she was in a wheelchair, and she was going to need a few months of rehabilitation services, but in the meantime, she still needed to be able to get out and do her chores and get things done, and we're able to come in there a few times a week and provide that assistance for her.
Wonderful. So Ryan, tell us a little bit about how you got involved in this aspect of senior care.
Absolutely. So basically in 1969, my aunt started the company out of Concord, Massachusetts, and then it moved over to Lexington, where we're still here today. For myself, I grew up in Massachusetts and went to Concord Carlisle, and then after college in 2006, I decided to move out to Colorado. While I was out there, I was having fun out there, but I unfortunately got a call that my mother had stage 4 end-stage cancer. So I moved all my stuff from Colorado, moved down to Florida to be by her side, and I got to see firsthand what home care and hospice can do for a person. Even though I'm a pretty big guy and I could pick her up and assist her, sometimes it was we needed assistance as well. And while I was down there, I spoke with my aunt, who said, if this is something you're interested in, I have this home care company up in Lexington. Would you like to see and take it over and start working on bringing it back and helping people? And I thought it was a great way to get back into my community and help people out, because I had seen how much it was helpful for my family when my mom was needing it and when she was going through very difficult times. So that's why I got involved.
Wonderful. So a real personal story, a real personal
Absolutely.
connection to this provision of care.
Absolutely.
Fantastic. And in terms of how to get a hold of you, Ryan, is there a number or an email
Absolutely.
address that people might be able to reach you at?
Absolutely. Our number is 781-862-3300. If you call, you'll get somebody live that will pick up the phone. There are 3 of us in the office, and you can let us know what you need, and we can do our best to help you out. And if we can't help you out, we'll point you in the right direction where you can get some help.
Fantastic. Ryan, thank you so much. We appreciate all of this helpful information about understanding what non-medical home care is and how beneficial it can be to seniors and those with disabilities in the area. So thank you very much for joining us today. I appreciate it.
You're very welcome. Thank you.
And thank you all very much. We appreciate your tuning in today. I want to thank our staff. Thank Ron Zimmerman, who is our technical assistant, and Bob Gottlieb, who is our director. And thank you for watching Older and Loving It.